Greetings, everyone. My name is Poran. I am a psychotherapist in private practice and also offering psychoeducational programs and clinical supervision to a group of multidisciplinary professionals and individuals and groups who want to improve their interpersonal relationships. And today I want to talk about interpersonal psychotherapy. If this is the first time you're in my channel, please like and subscribe, and I appreciate your help to reaching out to more communities. So, interpersonal psychotherapy is a modality that is proven to help with the depression, anxiety of the person going through interpersonal challenges. However, I don't want to talk about this modality just in a clinical way because there is tons of information out there. I want to connect interpersonal psychotherapy to improving and reducing anxiety and depression symptomology in our multicultural communities. Therefore, we need to pay attention to the need for culturally tailored programs and tailored treatment options when we are talking about interpersonal psychotherapy. I mean, culture and cultural factors are the main domains of how we are developing our interpersonal skills. That's for sure what we know. And also, we know that there are tons of research indicating that once we improve our interpersonal communication style and kind of affect regulation style, coping styles, and solution focused type of problem solving styles, then we improve in our symptoms, whether it is depression and anxiety. In multicultural communities, there are tons of issues going on, depending on the culture and community. In my Iranian community, there are tons of cultural barriers and limitations and stigmas that stops the person to be able to say what is they need and want. Therefore, once we talk about interpersonal communication styles, we have to know at times this is not actually interpersonal. It is one person to another person's style communication that has been going on for a long time in certain cultures, decades or centuries. Therefore, especially some women, they are not able to talk back in terms of what they want. And it's not only gender based, it is about how the person has learned to be able to be assertive, able to explain what is the emotions and behaviors they are being challenged with, and also what kind of impact of relationship, what aspect of the impact of relationship they're suffering from. At times, once you're not able to talk back, of course, the sense of not being heard, not being understood, not being validated, not being important. These are important aspects of interpersonal relationship. I know that there are tons of modalities. I mean, people go through kind of interventions such as cognitive behavior therapy, psychotherapy, psychodynamic psychotherapy, and psychoanalysis, and behavior therapy, family therapy, and group therapy. These are many options for interpersonal relationship building and capacity building for individuals. However, in all these modalities, we have to pay attention to what are that we are trying to teach in terms of thinking about the components of a interpersonal psychotherapy. There are three components, as I understand, based on most research I have seen: the psychoeducation part, the affect regulation skills building, and also the personal kind of assertiveness support for the person to deal with the traumas and symptoms and so on. However, we have to understand what are the skills we are trying to teach, not only through the psychoeducation and also through the affect regulation and also the interpersonal relationship for the person. So I have kind of worked with so many different communities for 30 years, and this is the part of the casework I have done and also testimonial that I have been given by people. Once you are able to help the person to define who they are, I mean, in my view, identity, confusion, identity uh, uh, search of the person in an interpersonal relationship is huge and is important. The person want to know who they are, what kind of relationship they are in, and what aspect of this relationship is bothering them. So relationship is a two-way around. However, some relationships is not the two-way around. So therefore, we have to pay attention to the details of what culture, what context, what psychosocial environment the person is living with. I mean, I give you an example. For years ago, I was working with a female with three children, and the interpersonal relationship with the husband that was, according to her, very kind and supporting. It was not the best because she was always fearing to say things that bother him or make him upset or feel him inadequate. Therefore, she was keeping a lot of things to herself. I mean, what was bothering her in her daily life and task. Therefore, their interpersonal relationship, in my view, was dysfunctional. And once she realized that this is dysfunctional because she is not able to say or express herself and just be able to manage to kind of went through the challenges, the struggles, and the anxiety and sadness she's going through with everyday life, and being impacted by diverse type of factors, the interpersonal relationship she had with her community, parents, extended family members, friends, and social network. Therefore, once we talk about improving interpersonal relationship, we need to kind of first perhaps make a map of what kind of relationship person has with who, and what degree, and what is involved, what kind of limitation or barrier is there for the person to be able to express themselves. So and also in terms of interpersonal relationship between parents and their adolescents and teenagers, this is also something to think about. Often uh, in families or communities, that the interpersonal relationship is not really encouraged because one way personal relationship is encouraged. One person talks and the other person listens, right? One person says what direction to go, the other person has to follow. And in those dynamics, what are the children and teenagers they are witnessing, what are they learning, and how they are being affected by the one-sided relationship. Therefore, yes, as psychotherapists, we are trying to improve people's relationship, but at the end, we have to kind of make an assessment and judgment, clinical judgment, in understanding if the education and the teaching that we are offering, does it help? Does it go a long way? And what is the outcome? I mean, is a person actually able to go and talk to their partner and express themselves, or do we need a family system therapy. I mean, bringing in the family. So if you are someone who are going through some interpersonal challenges, perhaps you need to bring in the whole family. I mean, or see someone and be able to kind of clarify what is the need for everyone to express themselves. I mean, perhaps if you are having challenges, maybe other members in the family, they are seeing, noticing, and they have also challenges and they are not saying anything. You never know. And clarifying, confirming, evaluating, expressing, these are all good things that can happen, and helping the entire family and extended family even to kind of function better. So, in terms of social skills, I mean, what do we learn in true? If we go for interpersonal psychotherapy, yes, we learn healthy communication style and attachment styles. We learn how to problem solve without getting into kind of extremes of emotions, and how we can using our emotions in a healthy way to be expressed and be shown to the other person and other people involved. So therefore, it's a both side work. I mean, if we want to improve our interpersonal relationship skills, we better to help other persons who are involved in that interpersonality of the relationship and the intersectionality of the relationship. They also improve their relationship. And also in a multicultural context, we have no idea how cultural values, beliefs, and faith and barriers and so on could influence the type of communication that is going on, and misunderstanding, judgment, and disappointments. Of course, these are usually the outcomes, right? So if we want to do better, we need to feel better, we need to think better, we need to seek support and know that help is available out there. And hopefully, not only you help yourself and your family and your children and also your communities, but also you learn how to kind of use those skills in other settings like as work and social skills and so on. Okay, so this is what I want to talk about, and I hope that you take it and share it with other people, and you let me know what kind of questions, feedback you have for me. I appreciate it. Take care. Bye.